Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. Now, despite decades of research, there's still no cure for ALS, or amyotrophic lateral sclerosis. It's sometimes called Lou Gehrig's disease. It's a progressive and fatal neurological disorder, but some new data shows some potential promise for slowing down this disease. Joining us here on Health Professional Radio with some of the latest research findings are Dr. Sabrina Paganoni, investigator at the Sean M. Healey and AMG Center for the ALS at Massachusetts General Hospital, and Justin Klee, the co-founder and CEO of Amylyx. Welcome to the program. Dr. Paganoni, what do the new data mean for those diagnosed with ALS?
This is such a fantastic step forward in our fight against ALS. This is about AMX 35, which is an investigational product. In our trial, patients with ALS who took the drug did better than those who received placebo. That means that they were able to remain independent for longer with activities of daily living, such as walking, talking, swallowing food.
Could you go a little bit further into what this change in the scale means for some of the other daily activities of people living with ALS?
Well, as you may know, people with ALS experience progressive muscle weakness. What this means is that over time, they lose the ability to do the things that we do every day that we take for granted, like walking, climbing stairs, talking to a friend. And so what we saw in the trial is that people who took the investigational drug were able to retain these functions for longer.
So, Doctor, what are some of your expectations or maybe some of your hopes for the future of the ALS community?
Well, I want people to know that there is such great progress in the fight against ALS. We're just at the beginning of a new era in the discovery of new treatments. We're testing more investigational products at a faster pace than ever. So I think there is hope. So it's important for people to stay engaged, stay informed. There's a lot that the research community is doing for people with ALS.
Now, Justin, as co-founder and co-CEO of Amylyx, could you tell us a little bit more about this therapy?
I'd be very happy to. Thank you. So AMX 35 is an investigational product that we've been working on for a number of years now. Originally, my co-founder Josh and I came up with the idea in a dorm room a little over 7 years ago, and we thought we had an important treatment approach for diseases like ALS and potentially Alzheimer's and others as well. And no one else was pursuing it, and so we thought, why not us? Let's start a company and see where this goes. We've had some tremendous advisors along the way who helped us get to this stage, including Dr. Paganoni, who's been just the most wonderful partner for us. And now we're working with health authorities worldwide to figure out how do we get this to people as fast as possible, because people with ALS have no time to wait.
Exciting and promising. Justin, where can our listeners learn more online about this?
So people can go to our website, amylyx.com, amylyx.com, or follow us on Twitter at Amylyx Pharma. I'd also encourage people to go to the Sean M. Healey and AMG Center at Mass General Hospital, as well as their local ALS clinic. As Dr. Paganoni said, there's some wonderful research going on right now, and the whole community is really excited about where we are today.
Thank you so much. Well, I appreciate both you, Dr. Paganoni, and Mr. Klee, for joining us here on Health Professional Radio this afternoon. Lots of great information and lots of hope for the ALS community. Thank you both.
Thank you very much for having us.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.